I am Dr. Javed Iqbal Khokhar, Professor of Forensic Medicine and Toxicology, and we're discussing the mechanical injury. And this is the 5th lecture of the series. And we are discussing factors which are responsible in the causation of wound production. And in this lecture, I will be discussing the role of subject or the contact area factor in the causation of wound production. So the contact area factor. Contact with the tissue is very important factor in the wound production. Unless there is a contact between the subject and the object, wound cannot be produced. There is some points which must be taken into consideration, that there is an area factor. Area factor means the area at which the weapon is going to strike. Then the target area, which is the target area, and what is the role of movement of the target. So these points should be kept into consideration when we explain a wound. Regarding the area factor, the wound will depend upon the amount of energy liberated or transferred to the area of the tissue and the rate at which the energy is transferred and the site of the target area. So that means the site of the target area is important and the amount of force which is liberated at a particular point, that is important. Therefore, the amount of energy liberated and the target area are the most important factors which will depict the appearance of the wound. Energy transferred is directly proportional to the severity of the wound. That means the amount of energy which is going to be transferred, that will affect the severity and the amount of damage. Similarly, the size of the target area is inversely proportional to the wound, which means if the force is being transferred to a broader area, then per unit area, the dissipation of energy will be less as compared to when the force is being concentrated upon a single point. Then the whole energy will be concentrating at a single point. Hence, higher the amount of energy transferred and smaller the area of impact, there will be more severe wound in appearance. Now the target factor. The target is the point where there is maximum concentration of the force or energy, and here the wound will be produced. Sometimes the local damage at the site of impact is either absent or minimal, because the energy is concentrated at a site which is away from the impact, like jumping from the height. The energy is transferred through the vertebral column to the base of the skull, where the energy is maximally concentrated. And the fracture of the base of the skull will occur, which is the remote area than the impact area. The feet are the impact area which are striking to the ground, but the damage is occurring at the base of the skull. This is a diagrammatic representation. The person is jumping, feet are striking, which are the point of contact, but the fracture at the base of the skull, through the vertebral column, the energy will be dissipated. Another example is in the road traffic accident, where the driver is sitting and applying brakes, and the impact will be concentrating at the hip and the pelvis, where the force is finding resistance, and the typical injury of the fracture of pelvis will occur. And driver is also holding the steering column forcefully, and through the bones of the forearm, the energy is being transferred to the shoulders and the fracture of the shoulder joint will occur. This is the diagrammatic representation. From the feet, the energy is transferred to the hip, and from the hands, the energy is going to transfer to the shoulders. Now, the movement of the target. That means the person is fixed, unable to move, or he is able to move. There are few situations in this regard. For example, body is free to move. In this situation, the local damage will be much less severe because part of the force will be applied, which is applied will be dissipated, and as the body moves in other direction, only fraction of force will be available for causing the damage. Like road traffic accident, when the body is thrown away, setting the body into motion. That means when the body is free to move, the much force is utilized in moving the body, and then less force will be causing trauma. And if the body is supported by something that is unable to move, the person is lying on the floor, standing against the wall, then the local damage will be much severe as the whole energy will be utilized in the production of the wound. In road traffic accident, if the body is supported by the belt, this also causes local damage because the body is supported and unable to move, and something striking will cause the maximum damage. Another example, when the moving object hits a stationary part of the body. When a moving object strikes a stationary body like skull, then the local damage is more. And when the moving body part strikes a stationary place, this is another example. The classical example of this is when the moving head strikes to the dashboard. As the bony skull contains inside the membrane, the brain, and brain is in cerebrospinal fluid. The sudden obstruction to the moving head occurs, but the contents are still moving inside the skull. And sudden striking of the head leads to concentration of the force at the point of strike, at the point of impact to the dashboard, and the contusion and laceration will occur at the skull point where it is striking. The inside brain, due to compression against the skull, suffers damage. The brain is still moving, skull has stopped moving, and this will cause the concentration of the force in the brain to accumulate at a point of impact, that is the co-injury. This is the point of impact where is maximum concentration of the brain matter, and it will cause laceration and the bruise formation. Exactly opposite to the point of impact, there is negative force, deceleration, and there is avulsion of the brain attachment from the negative area, opposite to the skull point of impact. That is contra co-injury. Opposite to the point of impact, there is negative vacuum pressure or avulsion, and that will also cause the damage to the attachment of the brain, and this is contra co-injury. This is the contra co opposite to the brain injury. So summary of this lecture is that we have learned that what is the role of contact area, that the tissue where the force is being struck. And we have also learned that the area of contact is important. It is soft tissue, it is hard tissue, and what is the target area and what is the role of movement of a target. Then we have also learned that what amount of damage will occur when the body is fixed, unable to move, and when it is free to move. We have also learned the point of maximum concentration of the force in coup and contra coup injury. So thank you very much. Take care and Allah Hafiz. If you like my videos, please subscribe to my channel, and this is my channel name, Dr. Javed Iqbal Kokhar. Thank you very much.